think we're good to go. Isaiah?
Yeah, I think, is it on?
Yeah.
Yeah.
Okay, awesome, great. Welcome. Thank you guys for joining me tonight. For those who don't know in my audience, I hope we are live, but for those who don't know my audience, I have my colleagues, my freshman colleagues with me, who are other council members who have stepped into this like whirlwind. So for you guys, I know you guys are busy. I know sometimes you can chime in, sometimes you can't, but I've tried to go live every Monday just to give people an update what's going on and answer any questions that people might have. I know every once in a while you guys chime in, but I just thought this would be cool because I think one of the things that ends up happening is two things. I think number one, people don't really know what we're doing during this time, specifically council. But then the other side is like people don't really realize like, look, we just regular people who represent who have everyday problems like folks do, like other folks do in the midst of this, specifically thinking about the common thread of us all being parents and all being new to council and things like that. So I'm glad you guys can join me tonight. I was hoping we could start just by taking a minute to let everybody introduce themselves, and then we can just kind of dive into coronavirus update, but then jump into some, get to know me type stuff as well too. So on my screen, Kendra, you're next to me. So if you want to go first, I'll tag you. I don't know who the order on other people's screen. This is my first time doing this.
Okay.
But I might just be happy to see people. You know what I mean?
So what is it? So what? Hi.
Tell them who because everybody in my listening audience, just introducing yourself to them. Because I'm not really, I could be honest, I'm not quite sure how this live is actually working right now. So I'm hoping that everybody can see it. But it is what it is. But if you could just introduce yourself, say what you represent, all that stuff. Zeke, come on, you killing me, buddy.
Okay. All right. So hi everyone. I'm Kendra Broad, council member at large. I'm with the Working Families Party. And I ran for public office because I believe in people. I believe the power of people. I come from the world of activism and organizing. So that's how I entered politics as an activist. And this has been an interesting first 100 days for me.
Oh man.
My colleagues. So not only did I have to quickly learn my job, also had to learn the new rules that went with the current situation that we're in. But I'm happy to have such wonderful colleagues like my freshman team here. They keep together. Be able to stay focused, grow and learn, and also be able to reach out to constituents from across the city because we all represent different parts of the city, but we all work together, and that's the most important thing. Yeah, that's who I am. That's what I represent. I'm gonna pass it to Kathy since Councilwoman Jamie and I are matching, so I'm gonna pass it.
Well, good evening, everybody. I'm Councilmember Katherine Gilmore Richardson, representing the city at large, which means I represent the entire city of Philadelphia. And it is truly my honor and privilege to join you this evening. So thank you, Councilmember and freshman colleague Isaiah Thomas, for welcoming us to your live post. But I come from City Council. Prior to running for City Council, I worked as a staffer, starting as an intern and a volunteer when I was in high school and through college and grad school, and then serving in every position that you could serve in a council office except communication. So this whole Zoom post and the live was not something that I worked on in my time in council, but really my focus and my concern is really helping people, everyday people with everyday quality of life issues in our city. We know that, and I always say that your zip code should not determine your life expectancy. And I think that that is even more true in this COVID crisis that we are seeing now in our city. So it's truly my honor and my privilege to serve people, help them as best as I can with any and all issues. And I look forward to the conversation.
I guess it's my turn.
Of course, last but not least.
Yes. Good evening, everyone. My name is Councilmember Jamie Gaudier. I represent the 3rd District, which includes large parts of West and Southwest Philly. Prior to City Council, I spent most of my career in nonprofit and community and economic development. I'm an urban planner by trade. And so before Council, I spent a lot of time at an organization called LISC funding the development of affordable housing. I led the Sustainable Business Network, helping locally owned businesses to start and grow. And right before Council, I was the executive director of the Fairmount Park Conservancy, helping to build our neighborhood park. So I like to say that I've spent the last 15 years helping Philadelphians to build their neighborhoods. And I wanted to run for council because I saw that as such a great opportunity to help residents in the 3rd District to build the communities that they want to live in and that they feel they can thrive in. And so that's why I was so excited about this opportunity. I'm also from the 3rd District originally.
So I'm for your audience, because I kind of see how it's working now. I'm Councilmember Isaiah Thomas. I'm Councilmember at large for those who might be following my colleagues live, but not necessarily following me. Just wanted to also introduce myself and, try to come live every Monday night. Glad that my colleagues can join me. And again, this is just a way of us giving folks an update, trying to come to them in their living room, let them know what's going on and things of that capacity. So with that being said, I just wanted to take a minute to give people an update. I don't know if there's anything specific that you guys wanted to address. I wanted to give everybody an opportunity to essentially do that. So if anybody wants to go first, you can. I think if we could start anywhere, I think it's important for people in Philadelphia to recognize that the governor did talk about a tiered opening for certain parts of the states, for certain parts of the state. Unfortunately, that's not going to be us anytime soon, and we need to understand that that's not going to hit us. So I think that's the broad thing. If anybody wants to kind of jump in and talk about different things that's going on that folks are working on, as well as updates that people need to know, I'll just let you guys jump in. And I also have a couple questions that people have already submitted that I'm going to throw out there for the group as well too.
Okay, I can start with an update on the numbers. So every day I try to share the latest update around presumptive positive cases of coronavirus in the city, as well as the total death count from each evening. So today, the Department of Public Health, via our health commissioner, announced that we have 302 new cases of coronavirus since yesterday, for a total of 12,868 cases in our city. They also announced 12 new deaths for a total of 484 deaths since the beginning of coronavirus. Our health officials are telling us that that is a small sign of hope, because last week we did average 550 new coronavirus cases for the week. And also we averaged around 20 new deaths for last week. So to see 302 new cases today and 12 new deaths, although any death is significant, but to see the numbers starting to come down, or what we refer to as a flattening of the curve, is a very good sign. So we need to continue to encourage our family and our friends and everyone in our space to continue to practice social distancing. When you go outside for anything essential, like food or medication, be sure to wear a mask. And that was in the governor's order from last week, that any store you go into, you must wear a mask. So it's important now more than ever that we continue to follow the, and I like to say physical distancing guidelines, because social, we're being social right now. But physical distancing will be very important in wearing masks for us to continue to flatten that curve. And I wanted to put a quick plug in for the text service. If you would like to receive the updates on a daily basis, you can text COVID PHL to 888-777. So if you want the daily updates from the city, just text COVID PHL to 888-777. So that's the daily update.
Can somebody put that in the comments section? I know it's a lot of staff that's like watching right now. For the folks that's in the audience, can we just have somebody throw that in the comment section? I think that's a real important point. Thank you, Kathy.
Sure, and we share the daily updates each day on social media at Councilmember KGR and also on my personal Facebook pages so that we can continue to keep the general public informed about what's happening around coronavirus on a daily basis.
I'll jump in and give some updates on the stay-at-home order, if that's okay, Isaiah.
Yeah, definitely.
So as Councilmember Thomas mentioned, our city shutdown order remains in effect until further notice. So that means that all public and private gatherings of any number of people occurring outside of a household are prohibited, except for essential businesses and their staff. And like Councilmember Gilmore Richardson mentioned, that means that we can go outside to do essential activities like purchasing food or seeking medical attention, but we recommend, or even caring for a family member outside of your house, but we recommend that folks wear masks to remain safe and to keep others safe when you go outside your home. We also, the shutdown order also allows for outdoor activities such as walking, running, cycling. We do strongly urge people to wear a mask. I'm a runner, so I'm outside on almost a daily basis running, and the amount of people running without masks is very scary to me. So please wear a mask so that you can protect yourself and other people too. And we're still allowed to do walk-in. We are not allowed to do walk-in takeout orders, but we can do online takeout orders and takeout orders done by phone. And that's a way that we can continue to support our favorite restaurants. I will say, some of you may have heard Governor Wolf did say that construction was going to be allowed throughout the state beginning May 1. So construction is going to start happening again throughout the state under very strict work conditions, and Philadelphia is trying to figure out what that means. And so that's the sort of one of the exceptions to the shutdown order that will take place soon.
Cool.
All right. So my updates are going to be about testing and the importance of testing. I want to make sure that everyone knows that testing is available throughout the city. Who should be tested? If you are over the age of 50, if you're a healthcare worker, essential staff, if you live or work in a group home or shelter, if you have chronic health conditions or diseases such as diabetes, heart disease, and lung disease, or you have been in contact with someone who has been known to have the COVID-19 virus within the last 14 days. Or you have severe worsening illness that must be hospitalized, it's important that you get tested. The next question is, where do you get tested? You start with your healthcare provider or a healthcare system where you last received services. So I go to Temple Physician, so I would start with my primary care physician and get a referral. Whatever. If you don't have a healthcare provider, you should call the Greater Philadelphia Coronavirus Helpline, and that number is 800-722-7112. Once again, that number for the Philadelphia Coronavirus Hotline is 800-722-7112. And you should also work with your medical provider to find accessible testing sites that are near you. If there are none in your area, you should look for the Black Doctors COVID-19 Consortium. They're coordinating weekly mobile testing sites in communities all over the city. And it's important that if you feel sick or you feel that you have been exposed, please get tested. We realize that it has been hard hit in our communities, and we need to make sure that we're taking care of ourselves and taking care of each other. So even if you have friends that are experiencing symptoms and they're telling you about them on the phone, please make sure you encourage them to get tested. We need to, as we flatten the curve, we also need to stay safe. And I just want to bring in the final sentiments around my comments is stay home if you can. As a mother with adult children, you know, it's gotten real for me. One of my daughters, I had to be honest, if you can't stay in, you got to stay out. It's that serious. And we need to make sure that we're protecting ourselves and our loved ones. So, you know, we need to make sure that, you know, we stay at home and take care of ourselves.
And I just wanted to add in quickly from Councilmember Brooks' comments relative to the African American Doctors Consortium. That consortium has done a tremendous job around bringing testing to our African American community, where most often we see health disparities most exacerbated. So I just want to give a shout out to the African American Doctors Consortium. If we could put their link in our live, if we could support them. Tomorrow they'll be at Yesha Ministries in South Philly. I spoke with my colleague, Councilmember Johnson, earlier. So thank you, and State Rep Harris and Senator Williams and all of the partners in South Philadelphia for bringing the Black Doctors Consortium to Yesha Ministries tomorrow. And if we could just put the link with the information in the post, that would be most helpful. But for, again, individuals who are over 50 exhibiting symptoms, you can go and get tested. So thank you very, very much, because that is super important, particularly the work of the African American Doctors Consortium.
Yes.
Yeah, I agree with you 100%. I think two things. First, Kendra, I just kind of realized that you got the difficult task out of all of us of having those adult children that you're a parent of. I thought little Zeke was rough. I can imagine with those conversations alike. But yeah, kudos to you for that. And then Kathy, just bringing that up, I think that's a perfect bridge into the next thing that we're supposed to talk about. I wanted to kind of touch on is just different things that our office has been working on. And so just because I know you guys and because our staffs work together, I know that it would literally be impossible to sit and talk about all the different things that we're working on since coronavirus hit, when you're talking about the different calls that we're on, as far as collecting information, to the different advocacy initiatives that folks have been either a part of or decided to spearhead, to all the different, you know, post-coronavirus things that we're essentially thinking about and planning for. So with that being said, I just wanted to take a couple minutes to just give people an update about some of the things that we're doing and what we're working on, because it's easy for folks to say, you know, council is a legislative body and we're not able to meet and have council sessions. So if you're not having council sessions and you're not essentially legislating, what are you doing? And I think people have the right to ask that question because we represent them and their tax dollars pay our bills. And so Kathy, I know you were the person who made me aware of what was going on with the Black doctors. I'm not sure if that was one of the things that you wanted to highlight, but I appreciate you for your advocacy there, not just informing me and other members of council, but also for pushing council president and pushing the mayor to contemplate or figure out a way to get them some resources. So I'll pass it to you, and then we can just you know pass it to who you want, and I'll close out.
Sure. So no, I think we all are trying to figure out what this new normal looks like and what our advocacy roles will be during this process. I don't think any of us imagined or anticipated, you know, in January on Inauguration Day,
Right.
that serving during a once-in-a-lifetime pandemic that for the time did not allow us to have regular council sessions. So while we are all continuing to work and work with our leadership team and our colleagues around being in compliance with the Sunshine Act as it relates to the city council meetings, here's some of the things that I've been working on and are advocating on behalf of in conjunction with other colleagues. So like you said, the African American Consortium of Doctors, I'm going to talk about them until I am blue in the face because they need our support and more importantly, because what we found looking at the data and the research initially is that the positive cases or the number of positive cases were in areas of Philadelphia that did not reflect the majority minority. So after some time, we started to notice that there was an uptick in cases in minority, particularly African American communities. And the testing availability just was not there. So I applaud the administration for expanding the testing availability to the federally qualified health centers, as well as other health centers, but we have to continue to do more because the health disparities that have been in our health system are only exacerbated by this crisis. So I'm going to be pushing not only for the African American Consortium of Doctors, but doing all that we can to really, taking a radical lens and look at the social determinants of health and how we use this crisis as a clean slate for us to do things differently around our healthcare delivery system, particularly for those that are most vulnerable. The other thing that I've been working on is our conversations with the council member series that we've had on Zoom, and we've had a number of calls. We had a call with Congressman Dwight Evans around the Federal CARES Act, the first version of the Federal CARES Act. We had a conversation just last week with our Democratic Whip, Representative Harris, and our Unemployment, Labor and Industry Secretary, Jerry Olsiak, around unemployment questions for constituents. And that was our most attended call. We've already had close to 1,000 playbacks on that session to give constituents and community members direct information from the top unemployment person in our Commonwealth about the process and what's happening, and just to get updates on your PIN number or this particular issue happened and now what. So we had a conversation with our unemployment secretary, also with all of our chambers, so the Greater Philadelphia Chamber of Commerce and all of our ethnic chambers around small business support and what more we should be focusing on to support small businesses. On Friday, March 13th, my office sent a letter to the mayor calling on them to create a small business relief fund. And while the fund is not perfect and does not have, all the dollars we need to support every small business in Philadelphia, I think it was an important step for us to undertake so it can complement any additional funding out there so we can support businesses who in turn employ a lot of people across our city. So really trying to do something to assist employers and the workers. We also had a call with our Committee on Environment, of which I am chair, earlier last week around Earth Day. Last week was the 50th anniversary of Earth Day. So we had a call to really start to talk about and frame out what a Green New Deal looks like for the city of Philadelphia, and using this COVID crisis as an opportunity for us to change the game and rethink how we can work on climate change and our environment and sustainability in our city. So we had our first call. We had several members of council in the committee, and thank you, Councilmember Gaudier, for all of your important feedback on the call. But we are going to use that information to ensure that we are mapping out a plan and a roadmap for how we move forward. And then lastly, next month is Mental Health Awareness Month. So we're going to have a call and a conversation with the council member around mental health and COVID-19 with our Department of Behavioral Health, Intellectual Disability Services. So that'll be on Monday, May 4th at 2 p.m. We are continuing to do additional advocacy around supporting feeding sites also in other communities. And I'm working with Councilmember Jones and State Rep Morgan Cephas on additional feeding opportunities for Winfield and for Winfield Heights. And then again, just all the advocacy around the public health space. So that's some of the things that I've been working on.
You can't name
the past few weeks.
There's just a couple of things that I know you got going on that you didn't list, and I'm pretty sure you don't know. But no, I think it's important. I think it's important that people recognize what their elected officials are essentially doing right now. So yeah, thank you. I appreciate it. Kendra, Jamie, who rock, paper, scissors, 1, 2, 3, shoot.
Jump in. I can jump in. So during this time, I entered talking about the need for affordable, accessible housing here in the city. So some of the things I've been working on is just trying to secure housing for folks in the midst of this pandemic. Right before our last council session, I issued a moratorium to begin conversations on utility shutoffs and eviction moratorium. So those are the things that we started on, and we're looking to end up on some stabilizing housing during this pandemic is something that we're working on currently, as well as maybe something around eliminating late fees for folks that are affected through COVID. Also, I've been working on paid sick leave legislation for those that have been affected by the COVID pandemic, meaning that you're guaranteed 2 weeks of time to handle you being sick from the coronavirus or for caring for a loved one because of the coronavirus. Because we had several folks calling the office saying they were unable to take off from work because of illness, and they were still being forced to go back to work. So we're working on legislation to support folks around that. I too have been helping with feeding sites in Germantown and as well as South Philly and Southwest. We've been delivering food to the elderly. We've been delivering with Kids Meals on Wheels, lunches to children across the city, as well as providing dinners for the homeless down at Dillsworth Plaza every other Friday of this month. So that's something my office has been actively participating in. And also making sure we're keeping the message out about the stay-at-home order, making sure people have the essential things that they need during this time. One of the things our office have been inundated with calls about illegal lockouts and eviction. So I want to let people know, like, it's illegal for you to get kicked out of your home right at this time. And if you have any problems with that, feel free to call my office. That we've been dealing with a lot of calls around illegal evictions during this time. Those are the quickest things that came to mind. So I'm gonna pass it off to Councilmember Gautier.
Sure. We've been pretty busy. We have a pretty active constituent services operation that's still operational, even though we're working from home. And so on a daily basis, my constituent services staff, Tariq and Alexis, are fielding phone calls from constituents and helping people to resolve various issues. We've been trying to be the best resource we can for constituents in our district as this crisis goes on. We created a pretty comprehensive document with resources that people can access now, whether it be food or housing resources. And we update that document daily, and that can be found on my Facebook page. We've been doing virtual town halls every other Thursday on a variety of topics that we think people want to know about and connect to during this time. So the Thursday before this one that just passed, we had a session on public benefits and how people can access SNAP, how people can access the new expanded unemployment program that has been put into place for COVID. And we have one coming up this Thursday at 4:30 also on food access and on how people in the district can get access to healthy, fresh food during this time of crisis. And we're also trying to do what we can on policy. Councilmember Brooks mentioned some of the housing policy that she's been working on. We've been a partner in that too, with the idea that, one of the worst things that can happen in this time is that people lose access to their housing, right? That's a public health issue because you can't quarantine effectively if you don't have a safe place to stay. And it's an economic issue. So we don't want people to lose access to their housing during this crisis. And we don't want people to fall into financial ruin because they owe months and months of rent and mortgage due to losing their job during this crisis. So we are working on a package of bills that will help renters to stay in their properties and to be able to rebound from this crisis. And we also know that we have to do something to make sure that small landlords don't lose their properties as well. And so it's been wonderful to work on that with Councilmember Brooks and Councilmember Gim, and we also welcome, we're looking for partnership throughout the council body. I've been doing a lot of advocacy in the area of criminal justice. Pretty early on, I teamed up with a number of council members who realized that the prisons and jails present a perfect storm for the spread of this virus in a way that is detrimental to inmates and to workers in prisons. So we've been putting a lot of pressure on the courts to release non-violent inmates from the prison system, and also to release our youth from the Juvenile Justice Center, because we know that this virus can spread quickly through the correctional system, and we've already had, unfortunately, a death in the prison system. So we continue to push in that area, and we've been advocating for workers. My office joined in with students on the UPenn campus and members of the UPenn community to demand for a better pay package for 140 dining workers at Penn, and we were successful in that. And that it felt really good to be able to make sure that those workers got treated the way that they deserved. And so we've been quite busy. I would say one of our biggest challenges has been reaching people who are not as virtual. And so we've got the virtual town halls, down pat. We've got our constituent services operation, down pat. But we've been thinking about how to reach the sizable amount of our district that's not as connected technologically. And so we're set to start an outreach project in the next week. We're going to be using a voter database that we purchased, and we're going to be enlisting dozens of volunteers and calling around to thousands of households in the district to do wellness checks, particularly on seniors, to ask them how they're doing, if they're safe, and what they need. And so the volunteers are going to be gathering that information, and my staff is going to be following up to ensure that we meet those needs. And so we are going to be looking for volunteers. So anybody who's interested in helping with that project, please contact the office at 215-686-0459 or jamie.gaudier@phila.gov. And so that's what we've got going on.
Okay, cool. So I think and I know, again, that's just like a piece of some of the stuff that you're working on, Councilmember Gaudier. And when I think about all those things in collaboration with the fact that, because I'm there with you, I know that there are daily calls. Some can last anywhere from 15 minutes to some maybe even an hour. I know that there are bi-weekly calls that you're also on. I know that there are state collaborative calls that you're on. There are federal government collaborative calls that you're on, health department collaborative calls that you're on. Based on the committees that you sit on city council, you're also on calls with your committees. Outside of all that, you still have your staff that you essentially have to supervise. So you have your calls and the internal things that you're working on, as well as supervising with your staff. Because I don't know about y'all, but I'm not a scientist. There's also a whole lot of research and reading and just collecting of data and information that I know that you essentially just have to do just to be as informed as possible when making decisions and figuring out what you're going to advocate for. And all this is on top of the fact that, you guys are all parents who probably have to also make sure your children are following the guidelines that they need as far as their academic experience and their socialization and things of that capacity. And so I know it's very complicated. I'm just wondering if you can just, and that's my rundown. I talk every week and tell people what we got going on and all the things that we're working on. I guess for the folks in your audience, a lot of the things you guys are working on, you know, that I support you, whether it's the housing stuff, whether it's the criminal justice reform stuff that we're collaborating on. My office, we're thinking a lot about the economic side as well, thinking about what do things look like after this. How can we not lay people off, and what can we do to be as fiscally responsible as we can to be responsible as a city. Thinking about what is the summer going to look like for sports and for summer programming and activities for young people and things like that. So like you guys, we're working on a variety of different things, but I thought it would be important for people to see the other side, where it's like, okay, boom, I got all these things that I'm working on, but I still wear these hats that make me a human. And I still kind of struggle with the mental health side and just being stuck in the house, and the fact that we too can't really come in much contact with people and don't communicate with people. So I'm just wondering, like, how are you guys just like handling all this and juggling all this while simultaneously being, you know, no matter how long or how much experience we have, I'm pretty sure we'll all agree there's nothing like being the actual elected official yourself. So we're all still new to the job. So I don't know. I would love to hear, you know, how do you guys handle and juggle all this stuff?
Well, I'll say for me, because I have the youngest kids out of everyone in our freshman group. I have a 3-year-old, a 5-year-old, and a 14-year-old. And it is very challenging because we all are working from home. My husband's working from home. My daughter is in pre-K, but she still has Zoom calls in pre-K. The 14-year-old has Zoom calls all day and researching data that she has to compile for the school that she attends, a public school. Shout out to our public schools, and to all the teachers as well. Shout out to all the teachers who are just going above and beyond the call of duty to ensure that our young people have the resources that they need. But it's hard. I am not going to sugarcoat it at all, but I'm not complaining, as my old boss used to say. I'm just explaining, okay? Because, you know, this is the work we have to do on behalf of people. So, you know, it's an adjustment period, and you go into this and you don't know how long, you know, something like this is going to go on. You know, week 1, I'm thinking, oh, okay, you know, a couple weeks, we got this. And now we're on our 6th or 7th week, and we're just continuing to do all that we can to, you know, adjust to our new normal, make sure the kids get in their time. I try to take them on a walk if it's not raining in the neighborhood, so we can get out and get a little fresh air and some sun. And we have some elderly folks in our community that we check up on practicing physical distancing. So we stay on the sidewalk and then they come to the door and we just check up on them. So that's a way to keep them involved, my kids involved and engaged in the work that we do. But it's challenging, it's not easy. And I think the work-life balance part of it too is like out the window. It is no work-life balance. And I don't think we ever had that in this position. And I think the campaign trail kind of, you know, helps you to be prepared for that. But it is no work-life balance, because you're home all day.
I've been doing well. You know, it was hard at first to get used to, and it's still hard sometimes to get used to being in the house and in the same place for most of the time. But I'm grateful to have work that is meaningful and work that can help people during this time. And so I've really been, you know, appreciating that, and appreciating the time with my kids, you know, when they're not doing their schoolwork and when I'm not working, we're watching Netflix, we're cooking a lot more than we cooked before as a family. And so those are the aspects of this that I really appreciate, and that I actually will probably miss once we do get off of punishment and get out
Yeah, for me, I think that I have the most varied assortment of children. So I have 12, 16, 20, 21, 29, and 3 grandchildren, and a son-in-law. My daughter's an essential worker, so she went back to work. Her husband is an essential worker. So I have my grandkids during the day in the midst of these calls. and just trying to keep the grown-ups in the house and making sure the ones that are school age to do their work while I'm on conference calls too. It's been very interesting. I think for me, being on the campaign trail and then immediately coming into office, that work-life balance was completely gone, but we've spending more time together as a family, which is really nice. I had an opportunity to teach them how to cook, which one of the regrets I had on the campaign trail, that I realized I have grown kids that don't know how to cook. So this gives me the opportunity to rectify that. So my daughter's in there cooking now. Smells really good. But just, I think this is the time to kind of hold them closer and, realizing that, I can't do it all, but for me to be the best mom I am to each one of them and my grandchildren in that moment, and kind of just embrace it all. And then on the flip side, I also have, I'm the matriarch of my family. So I have elderly parents that I have to check on that live in a different state. And I also have like elderly uncles and aunts that are in nursing homes and stuff. So I'm in a constant questioning of like, what's happening, what's going on at the nursing home. So like just trying to balance all this every day is really hard. So I'll be on that Monday call.
Yes,
because it's crazy. This is definitely a different time for us all. And, I'm just learning a greater appreciation for life.
Yeah.
Folks that are around you.
Yeah, I agree. I think that's been the light at the end of the tunnel for me. It's just knowing that this is, it's punishment for sure. Don't get it twisted. But it's also kind of like what you guys talked about, an opportunity to spend time with your family in a unique way that for us probably won't happen for the rest of our political career. So it's like, it's pulling teeth on one level, but another level is like, we better take advantage of some of the good stuff while we can, because we might not get this chance again. Okay, so this is my favorite part. So I really was like, it'll be great for people to get to know elected officials and, the other side of like the fact that I'm, regular, average, everyday person from Philly, especially all of us. So with that being said, I wanted you guys to think about we're freshmen, and this has been a crazy freshman year. So I wanted you guys to either think about your freshman year in high school or your freshman year in college, and just share something about yourself that, of course, you're comfortable with, that, people might not know. So I know for me, no, my wife trying to guess what it is. No.
You is making you ask that question.
Oh, so what? So I would say for me, it would be my freshman year in college. I think about the fact that like I had this crazy time period where when I first got to college, I wasn't focused, and I had always been a pretty good student who did a pretty good job of balancing athletics, academics, and my social life. And my freshman year in college, it was just a mess. It was like social life first, athletics second, and academics was like 12th on the list. And so like right there at the end of my freshman semester, like when I had got my grades from my teachers and I calculated them, my GPA would have put me to the point where I would have been ineligible to play basketball the second semester. So I was like heartbroken. Like I felt like a failure. I had came to college to play basketball. I had an academic scholarship for part of it. And, I knew that a lot of people would be disappointed in me. And so I basically like begged one of my teachers to change my grade and like give me an opportunity to do some extra credit, because I only needed like, I had like a D and I just needed like a C- instead of a D. And I had like a high D, like a 68. So I was like, 2 points would change my life right now. And the teacher gave me a chance. It gave me the opportunity to make up the work. And I did it, of course. And I said, I'm never going to put myself in this situation again, where somebody have like that much like power and control over what it is that I want to do. And after that, I never had a crazy bad semester. I was always, 2.5, then 3.0, and then 3.0 rocked out until I graduated. But that moment right there, if that teacher wouldn't have gave me a break, I am not saying I wouldn't have made it, but it would have been a different road, because I wouldn't have been able to play basketball, and that would have really hit me. So that's like something that happened my freshman year that I just never forget. And yeah, I figured, everybody got them moments where it's like, yeah, freshman year was a little rough, but I made it through it. So that's me. I don't know anything you guys want to share. I'm all ears.
Oh, I don't have much to say about my freshman year of high school. I was a nerd, y'all. I was in the band.
I didn't touch high school, Jamie. I left high school alone.
Yeah, I was in the band and I played the percussion, so I'm gonna just leave it at that. However, by college, I had come into myself and I blossomed a lot. And freshman year of college at Temple University was one of the best years of my life. I have a huge family. So my mom is from St. Vincent in the Caribbean, and she has 13 brothers and sisters. So all of us had a cousin growing up that was our exact same age. And my cousin, Lisa, was my best friend. So we grew up like sisters. We're 4 months apart in age. And she's sort of like the yin to my yang, or the yang to my yin, whichever way you want to put it. So we're like night and day in personality, but always been really close. And we both went to Temple and we were roommates, and it was the time of our lives. Like one of my best times. I'll never forget it.
That's what's up.
So we all from Philly, y'all. So we have to say our high schools.
Yeah, I was thinking that.
That's a big thing in Philly. We have to say our high schools,
right,
and then we can tell our college story.
My bad. I did go to Frankfurt. I went to Elwood, Conwell, then Frankfurt High School. That's where I graduated from.
I went to Central 255.
Girls High 245. Hey, Girls High.
I went to Martin Luther King.
Uptown.
Yeah. And go ahead, Kat.
No, you go ahead, Kendra.
I would like to throw away like high school and college and stuff that I'd rather not talk about. But I can say this freshman year in council kind of reminds me of my freshman year in high school and my freshman year in college. All this crazy as this. And I'll leave it at that. Anyone that knows me understands.
I love it.
No, so I went to Westchester University. Shout out to Westchester and all the Rams from Girls High, and I had a full tuition scholarship, so I had to keep my grades at a certain level. But my first semester at Westchester, I was introduced to the Blue and White family. So shout out to Phi Beta Sigma Fraternity Incorporated, Lambda Upsilon chapter at Westchester University. But I was introduced to the Blue and White family, and it was the time of my life. And my roommate, my best friend from Girls High, Debonair, we would travel all up and down the East Coast, going everywhere you could think of, Lincoln, Cheney, Bell State, because obviously Westchester is not an HBCU, but we visited all the HBCUs as much as we could, and really had the opportunity to develop relationships that are lifelong and lasting. But I enjoyed my first semester at Westchester, and like you, I had a wake-up call because I had a scholarship. I only got a 2.74 my first semester. So I'm like, I need to get it together real quick to get my GPA up. And it was the time of my life, the entire time at Westchester, from freshman year into graduation. So that was, my freshman semester.
That's what's up. Yeah, it's been a crazy freshman year, like Kendra said, and I'm just trying to, do our part and do the best that we can to hopefully put a smile on some folks' faces, even, and let them know that, number one, we're here to fight for them, we're working for them, but also, we're struggling like they are with everyday problems, because we're everyday folks born and raised in this city that's just doing our best to try to fight for the people who we know are the most vulnerable and who have the smallest voice at the table. And I think somebody mentioned it. I think it was Jamie. It's really important that we also continue to think about the folks who don't have access to technology. Like, we do a good job with this stuff. Before we close out, though, can you guys, everybody kind of talked about the different town hall stuff that they do. Can you just mention like the town hall stuff that you do one more time? If there's a flyer, definitely staff, drop those flyers in the comments so we can share. And we got to close out in about 4 minutes. So any final thoughts as well, too. leave with that. I mean, I go live every Monday, so thank you. Monday at 8 o'clock. So thank you guys for joining me this evening. But anything you do on a consistent basis, please share that with the audience so we can get ready to close out.
We have virtual town halls every other Thursday. You can check my Facebook at Councilmember JG to find out about them. The next one is this Thursday. It's about food excess. And just as a closing thought, I want to say I've been trying to look for the silver lining in this as a freshman council member. And what I've landed on is that if I can learn how to be a good council member during this time of crisis, where we have to really be imaginative to connect, I can be a good council member anytime.
Dope.
That's good. My team is working on our new platform around the COVID-19 and Black community. So we'll have that information posted soon, but I would suggest follow my council page at Councilmember Kendra Brooks. And you should see the updates coming up around that. And my final thought is just continue to smile through this and realize that we will get through this together. Yeah, and don't forget your neighbors.
Mhm.
Check on them.
So my closing comments are, again, thank you, colleague, Councilmember Thomas, for the opportunity for all of us to share and be on this call together. It's so good to see all of my freshman colleagues, even though we're always in regular communication. But everyone can follow my social media at Councilmember KGR. That's Councilmember KGR. And we post the daily updates from the City Health Department, as well as share information around our conversation with the council member series. We will have our next conversation on Monday, May 4th at 2 p.m. And it will be around mental health and COVID-19. So the information will be posted at Councilmember KGR. We also have a newsletter. You can sign up for our newsletter. That information is also on my page. And to all the young people out there and everyone just thinking about how this time has altered life's plans, I leave you with this. Life is a marathon and not a sprint. Life is a marathon and not a sprint. So the journey continues.
Thank you guys so much. I appreciate you joining me tonight. I appreciate all you're doing for the city of Philadelphia. I think about, how difficult of a journey this is, but I also think about how different the journey would be if us four specifically weren't at the table doing the work that we're doing. So I appreciate the opportunity to serve with you guys. I know firsthand the hard work that you have on ahead of you and ahead of us. And a lot of the dope legislation you guys are working on, that you'll have my support. And I appreciate what you and your teams have been able to do to advocate for those who need it the most. And I can name multiple things that you all have done that I'm proud to stand with all of you on each of those things. So thank you for joining me tonight. I appreciate it. And like very few people do, we're right on time. So how about that?
Thank you, council member.
Thank you. Thank you,
guys.
Martise.